Hi, I was talking to a fellow dental school instructor, and we were talking about how to teach pre-dox occlusion. And, interestingly enough, Hanau's quint kind of popped into my mind. Now, for those of you who remember Hanau's quint, this has to do with how to create balanced occlusion for our complete dentures. But you know what? It does apply to tooth restorations. Hanau's quint talked about the 5 determinants or variables that could affect our occlusal contacts, and they were the occlusal plane, mandibular condylar pathway, our incisal guidance, the cuspal angle or the cusp tips, and the compensating curve. So while this was designed to allow us to create balanced occlusion, meaning when the patient moved into protrusive or lateral movements, all the posterior teeth stayed in contact, and this helped stabilize the denture. Now, when it comes to tooth-borne restorations, obviously there are things we can't modify if we're doing 1 or 2 restorations, indirect restorations. One of them is we cannot change the condylar pathway inclination. That's a fixed anatomic determinant. Now, we can either restoratively or orthodontically change the anterior guidance, so we can do that and we can create a steeper anterior guidance, and this will allow our posterior teeth to separate better so there are no interferences. But typically, that's not an endpoint goal in everyday onesie-twosie dentistry. So if we return back to the situation that we have, where we have cusps that are possibly interfering, what we need to do is simply sit down with our laboratory technicians and educate them. And all we really want them to do and understand, as we move more posteriorly, the cusp tips should get shorter. And by shortening the cusp tips as we go posteriorly, this will allow them not to interfere and not create interferences both in protrusive and in lateral movements that we have to adjust, because that's a lot of work. Roger Levin looked at the approximate dental overhead in dental offices. He did a survey. It ran from $240 to well over $840 per hour. Well, this translates to up to $14 per minute. If we can train our technicians to help us at chairside, if we can simply eliminate 5 to 10 minutes of occlusal adjustment on every crown or bridge that we deliver, well, this will not only result in a cost savings, but more importantly, a more relaxed appointment for both the patient and us. And this will also increase the patient's perceived value of our services. And this is really the way we want to practice. Think about it.